Hi, my name is Courtney Riddle, and I wanted to discuss my views on health insurance and the Affordable Health Care Act. I currently work with an older population with an internal medicine physician, and I deal with mostly Medicare and Medicaid patients. Both Medicaid and Medicare are publicly funded social entitlement programs that are available to individuals that qualify. If the government misjudges their budget and falls short of their estimate, the government must still pay for the covered services the beneficiaries are entitled to. Since the budget is a huge issue, I suggested focusing on eliminating as much insurance abuse, fraud, and waste as possible. Some examples of Medicare misuse is knowingly billing for services or supplies that were not provided, which includes billing for a missed appointment by a patient. Also, knowingly altering claims forms or receipts to receive a higher payment amount, such as misusing codes on a claim, billing for services that were not necessary, or charging extra for services or supplies. For Medicaid, a few examples of fraud and abuse is when an individual doesn't report all income or other insurances when applying for Medicaid, or when a person uses a Medicaid card that is not theirs. Fraud from a provider includes not having accurate credentials, billing for unrendered services, and performing and billing medically unnecessary services. I think that funneling more money and manpower into organizations such as the Medicare Fraud Strike Force can help save the government millions of dollars. For example, in a report by the U.S. Department of Health and Human Services that was released in May of this year, discussed how the Medicare Fraud Strike Force had operations in 6 different cities that resulted in 90 individuals, which included 27 doctors, nurses, and other medical professionals, for participating in Medicare fraud schemes involving $260 million in false billing. Since 2007, the Strike Force has charged almost 1,900 defendants who collectively have falsely billed Medicare programs for almost $6 billion. It is pretty obvious with those numbers that we have got a serious problem. If 90 people in 6 cities can drain $260 million from a program, imagine how much money is being wasted over the entire country. Adding jobs to the strike force or creating any new entities of that can really crack down on the abuse, the fraud, and the waste, and save way more money than what we would spend on the salaries of those people that we had hired to increase this force staff. Another thing I believe that could help save money is to have stricter policies on narcotics. The abuse and selling of narcotics and the loose prescribing of them by physicians is getting out of hand. In 2010, 7 million people were using psychotherapeutic drugs non-medically. 5.1 million of those 7 million were taking some sort of pain reliever. One out of every 143 patients in the U.S. who received a prescription for an opioid painkiller in 2008 obtained prescriptions from multiple physicians in a pattern that suggested misuse or abuse of the drugs, according to a recent study that was released in May of this year. The technology of a state-run monitoring program is helping a lot of doctors realize which patients are potentially abusing narcotics. Where I currently work, we look up every patient that gets narcotics from us more than once on the Arkansas state-based website. We print that out for the doctor and give it to him. It lets us know which medication was prescribed, which doctor prescribed it, which pharmacy it was filled at, and how it was paid for. Whether it was paid for with cash or filed on insurance. Since we put it in the chart and the doctor has it when he goes in to discuss everything with them, he uses it to confront them if necessary and offer them the help that they may need for their addiction. If they refuse the help, he refuses to be part of their problem and refuses to write the narcotics anymore. He does, however, tell them that he'll be glad to manage their other health issues. I do think that micromanagement, to an extent, is a good thing. Figuring out which healthcare providers is part of the problem will help save money for all insurance groups, not just Medicare and Medicaid. Setting up more efficient monitoring programs could save a lot more money than it would cost to create them. As far as the top 3 things go that I have learned about this semester and plan on using, was when we discussed and studied about the healthcare reform, the finances of healthcare, and the comparison of the United States healthcare compared to other countries. The reform and financing of our healthcare system is going to affect us no matter what. Doesn't matter who you are, it's going to affect you, patient or provider. Having a better understanding of the laws and the system itself will not only help us become successful as nurse practitioners, but it will help us help our patients. In the lesson that we compared the country's healthcare systems to the U.S., it kind of opened my eyes as to how differently things are in other countries, and it was kind of a motivation for me personally to help our country become the best, the most envied country in the world. Thank you for your time. I appreciate you, and I've had a very interesting semester. I've learned a lot, and I do plan on using it later. Thank you.